What is functional bladder capacity, and why does it matter? Imagine your bladder as a balloon that can stretch to hold a certain amount of liquid before you feel the urge to go. That's essentially what functional bladder capacity is. It's the amount of urine your bladder can comfortably hold and then releases during normal bathroom visits. This isn't just about the physical size of your bladder, but about how much it can store and empty under everyday conditions. Doctors often measure this by asking you to keep a bladder diary or through specialized tests. In a bladder diary, you record how much urine you produce over a day or two, which helps determine your typical bladder capacity. In clinical settings, urodynamic tests are used to measure how much your bladder can hold and how it behaves as it fills and empties. For most healthy adults, the functional bladder capacity ranges from about 300 to 600 milliliters. But this can vary depending on age, health, and individual differences. For example, children tend to have smaller capacities, while older adults might experience changes that affect their bladder's ability to hold urine. Understanding your bladder's capacity is important because it directly influences your urinary health. If your bladder can hold enough urine without causing discomfort or frequent urges, it means your bladder is functioning well. When the capacity is reduced, you might notice symptoms like needing to go to the bathroom very often, feeling urgent to urinate, or even experiencing leaks. These symptoms can interfere with daily life and may signal underlying issues that need attention. Measuring functional bladder capacity helps healthcare providers diagnose conditions like overactive bladder, urinary incontinence, or other lower urinary tract symptoms. It also guides treatment strategies. For example, bladder training techniques aim to gradually increase this capacity by teaching you to hold urine longer between bathroom visits. This can help reduce urgency and frequency, improve bladder control, and enhance overall comfort. Maintaining a healthy bladder capacity is also vital for preventing damage. If the bladder overacts or holds too much pressure, it can harm the bladder wall or even affect the kidneys over time. For patients who have undergone treatments for bladder cancer, monitoring capacity is especially important because surgery or radiation can change how well the bladder functions. In practice, improving bladder capacity often involves lifestyle changes like fluid management, scheduled voiding, and exercises to strengthen the bladder muscles. These strategies, combined with medical advice, can help you achieve better bladder health and a more comfortable, worry-free daily routine. Remember, everyone's bladder is unique, so it's always best to work with your healthcare provider to understand your specific needs and develop a personalized plan.